So good morning, ma'am. I'm Andrik P. Cuba, and I am from BSN 1E. So I'm going to demonstrate the donning and the removing of sterile gloves. So the purpose of this is for the nurse to use a sterile gloves to avoid contamination and also prevent the transmission of microorganisms that can lead to infection. So I'm going to assess the record of the patient. So it says that I'm going to use a gloves because the procedure that I'm going to do is the dressing of wound. So next we're going to assess our hands if there are any cuts to prevent infection. And also next we're going to gather the equipments that we will be needing. So gloves is the only thing that I will be using in the equipment or in the procedure. Good morning, ma'am. So I'm Andrik P. Cuba and I will be your student nurse for today. So I will be the one who will assess on the dressing of your wound. Can you please state your name, ma'am? So the purpose of this, ma'am, is for the nurse to use a sterile gloves to avoid contamination and also to prevent the transmission of microorganisms that can lead to infection. So next we're going to perform a hand hygiene. Then if the door is open, we're going to close it. And also the curtain and window, if it is open, we're going to close it. So in opening the glove is we need to check for the manufacturer's order and also the expiration date. So usually the gloves can long up to 5 years. Then it says that peel down to open. I'm going to open it. I'm going to get the inner package of the glove. So I'm going to put it in a clean and dry surface. So in opening the inner package, avoid na matouch mo yung gloves because di na siya sterile. So avoid to touch the gloves to avoid contamination. So I'm just going to open it slowly. So this is sterile gloves and also the surface of the package is also a sterile. So next I'm going to put the gloves in my dominant hand, which is the right hand. So I'm going to use my 2 fingers to assess my right hand in putting the gloves. So I avoid to touch the outer surface of the gloves because the process of open method, it is the sterile to sterile. So dapat hindi mo siya matouch yung outer. So I'm going to put my fingers to support. I'm going to put my 2 fingers to support my hand in putting the gloves to my dominant hand. So just kindly and gently support your inputting the gloves. So just inputting the gloves, dapat tumawag pa lang sa tip or dito lang to avoid contamination. So I'm already done putting the glove in my right hand or in my dominant hand. So now I'm going to put the other glove in my non-dominant hand. So using these 4 fingers I'm going to put it under the cuff or the gloves, and also I'm going to put my finger in the gloves. So I'm going to put it under the cuff to support my left hand putting the glove. So just slowly put the gloves. So pwede mo siyang i-touch kasi this is sterile, also this is sterile to sterile. So you can adjust the gloves to be fit and also para mas maging smooth yung pagkakalagay mo ng gloves. Then I'm done with putting the gloves in my hands. So now is I'm going to discard the gloves that I've used. So there are no special technique in removing the gloves, but I'm going to do it in a better way. So I'm going first to remove the right glove. So in removing it, I'm just going to pinch it. Then I'm going to remove it. Then I'm going to dispose this to the, or put it back in the inner surface package. Then I'm already done removing the right gloves in my hand. So this is clean siya. And also let's just say that we're already done with the wound dressing. So this is contaminated, both gloves are contaminated. So avoid na matouch mo sa, para mapanatili mo yung kalinisan ng inyong kamay. So using these two fingers, I'm going to place it under the gloves. Like this. Then I'm going to slowly remove it upwards hanggang sa matanggal yung gloves. So I'm going to put it in the inner surface package. Then next, I'm going to dispose the gloves that I've used in a moisture proof bag or in the disposable bag. So next is we're going to document all the things that we've gathered, or ano yung ating ginawang procedure. And also we're going to remove all the things that we've used. Then we're done in the return demonstration and donning and removing of sterile gloves. Thank you.